Hey everybody, welcome to this 11th episode of Caregiver Coffee, brought to you by the Council on Aging in St. Tammany, or Coast. My name is Matt Estrad. I am a gerontologist in the greater New Orleans area, housed up in Covington on the North Shore. And so this is our 10 minutes or so to talk about caregiver topics for you to enjoy for yourself or to share with others. So we appreciate you sending in any comments or questions either on this video platform. Certainly you can send questions and comments right now while we're live. And this is now archived, when this is archived or is a recording, the best thing to do is to send me an email at matt@carepartnermentoring.com. Sometimes when the video is over, I'm not always alerted of all the different comments that might come in. So thank you for doing that. Today we're going to talk about caregiving in the United States. And I recently read a report with the same title that was created by AARP and some other organizations. And it really just talks about caregiving in the United States, how many people are doing it, and a lot of the demographics and other interesting statistics that you may find interesting. So we're going to talk about those. I have read the whole report, and I'm going to be going over some highlights of that report. So to begin with, how many people are caregiving in the United States? Well, it's 1 in 5 Americans, just over 20% of adults, Americans, are caregivers. Not all of those are caring for an adult, although it is many. We're looking at 16% were caregivers to adults in 2015, and now it's up to 19.2% in 2020. It's an increase of 8 million adults that are taking care of a family member or friend who's 18 years or older. Now, there's been a significant increase when you're taking care of a family member or a friend who's over 50, which might be many of the people that are watching this particular Facebook Live, because we are the Council on Aging. So the number of caregivers with recipients who are over 50 is 4.18 million people. So that went up about 2% from 2015 to 2020. And then we're looking at, as far as the age of those that are taken care of, 47% of caregivers, 74% of caregivers ages 75 or older are caring for a recipient that is around the same age, 75 years or older, while younger caregivers tend to take care of someone who's much younger, which would make sense. That's 81% of caregivers that are ages 18 to 49 taking care of someone who is 50 years or older, so that it might likely be a parent that they're taking care of, whereas the 74% are where they're taking care of someone 75 and older, is probably most likely a spouse or a friend. Let's see. And when we're looking at some of the issues that people are having, so we're talking about the care recipient, what kind of issues that they're having. Let's see. Memory problems make up 32%, which is up from 26% 5 years older. So an increase there. That includes Alzheimer's or dementia. That's 26%, up from 22%, which was up in 2015. Let's see. Data suggests that this journey through the healthcare system may not be as easy as it was 5 years ago. More caregivers say that it's difficult to coordinate their loved ones. It's either recipient or loved one, coordinate their care across various providers, and that's 26% that feel it's difficult. So about a quarter of caregivers are having trouble coordinating care in a complex healthcare system that we find ourselves in today. And I understand how that could be difficult when you consider that you have your primary care physician, but you also have specialists, like you have your neurologist, you have a cardiologist, you might have a rheumatologist, ophthalmologist, etc. And it's a lot to manage. And I would be curious to see if electronic medical records, if those are making things easier or even more complex, because I can see how it helps to, once you have like a login and you have an online portal, that you're able to coordinate the appointments, to see what appointments you have each week, to communicate with the doctors and the nurses. So I'm curious if y'all have any opinions on that. Have the online medical portals, the patient portals, has that made things easier or even more challenging? Because certainly the online portals are not required, but they certainly allow for more communication and options. The support and complex care tasks of the nation's caregivers that they provide are largely unchanged since 2015, with today's caregivers providing about 24 hours per week. So that's not 24 hours a day, but 24 hours per week, so about half of a work week. As in 2015, nearly all of today's caregivers help with the instrumental activity dailies of living. And that's 99%, which is, like they say, that's roughly all. So your instrumental activities of daily living are things like balancing a checkbook, paying bills, going shopping, running errands, setting up appointments. Now contrast that with the activities of daily living, and these are bathing, dressing, eating, moving around or walking, toileting or going to the restroom, and transferring from one place to another, like maybe getting out of your bed or getting into your bed from a wheelchair, etc. So only 60% of caregivers today are saying that they are providing these one or more ADLs for their loved one or whoever they're taking care of, and nearly 6 in 10, so 60%, they're helping with medical tasks. And this could be changing dressings, it could be administering medications, it could be helping with insulin. So these are things that are considered medical or nursing tasks. Now let's see, what else is interesting? About half of the caregivers said that there are others who provide unpaid help to their care recipient. So that's good. So this would mean that about 53% are not the sole caregiver. They may be the primary caregiver, but they have other unpaid help. Among those who report the presence of unpaid help, so the same group, 14% of them say that at least 14% of those unpaid caregivers is a child under the age of 18. So out of all caregivers of adults, 7% report the presence of a child caregiver, which is amazing. I can't imagine being younger than 18 years old and taking care, like actually like doing caregiving things. I mean, I would do it, but it's just it's something you don't think about when you think about childhood. But I have heard statistics like this before. It's just still mind-boggling that would be part of their experience. But it's whatever it takes to get the job done, to take care of ourselves, to keep our loved ones in the community, in the home, as long as it's safe. And while many caregivers feel their role has given them a sense of purpose or meaning, and that's half, 51%, these positive emotions often coexist with feelings of physical, emotional, and financial strain, with 20% feeling alone. When compared to 2015, fewer caregivers report their health status as good or very good. So it went down from 41%, let's see, it went down from 48% of those listing their health status as excellent or very good, down to 41%. So a 7% drop in those 5 years. 1 in 4 find it difficult to take care of their own health, and a similar proportion report caregiving has made their own health worse, which is very unfortunate. And we've talked about in previous caregiver coffees how important it is to make sure that you have your annual wellness visit, that you're going to your specialist if you have a heart condition, if you have arthritis, you're going to your rheumatologist, if you're having an annual eye exam. So these are things that maybe things you don't want to do, maybe things that do take time. and discipline to do when you're more worried about your loved one. It's really important. We talked about self-care. We've talked about the analogy of being on an airplane, and the flight attendant tells you that if the oxygen mask drop down, you put it on yourself first, and then you put it on your loved one who may need help. And that's because if you pass out due to lack of oxygen, then no one's able to put it on your loved one. So look at it that way as well. So here's some more statistics. Let's see. While caregivers rely on healthcare professionals such as doctors, nurses, and social workers as a source of information about providing care, by 55%, very few caregivers report having conversations with those same medical professionals with them as far as what they need to care for their loved one or their care recipient. So only 29% had conversations with their medical providers about the needed care, and only 13% of caregivers in this survey talked to their physician or nurse about supporting their own health. As far as the economic impact of being a caregiver, 1 in 5 report high financial strain as a result of taking on the role as a caregiver. 4 in 10 have experienced at least one financial impact from a result of caregiving, and most commonly, 3 in 10 have stopped saving. So about 30% have stopped saving because of the financial strain of caregiving, which is really scary because you need that rainy day fund, and you need it hopefully for your retirement. 1 in 4 have taken on debt. Caregivers of adults who find themselves providing care, they find themselves providing care for 4.5 years on average, and the increasing proportion have been providing care for 5 or more years. So let's see, 5 years ago, 24% had been taking care of their loved one or a friend for 5 years, and it's gone up 5 years or longer, and it's gone up from that 24% up to 29% today in 2020. 6 in 10 caregivers report working while caregiving, and the majority have experienced at least one work-related impact. In 2015, most working care partners or caregivers reported going in late, leaving early, or taking time off to accommodate care. 1 in 10 working caregivers had to give up their job entirely or retire early. So caregivers of adults have information and training needs to support their daily life. Increasingly, caregivers are recognizing that some services and supports like respite care would be helpful to their own situation. I'm glad to see that. Though actual use of the supports and services remains low. Just 14% report having used respite, that's really low, though 38% feel it would be helpful to have respite in the home. And that's something that that you should contact Coast about if you're interested in having respite, which is a short break, 2 to 4 hours, so that you can get a break yourself as a caregiver, so that you can go out and run errands, so you can go get groceries. Now, hopefully your family and friends are helping with that also, but Coast is there, so I encourage you to call the Council on Aging in St. Tammany and get on their list and go through the assessment so that you can either get that service or get on a waiting list for that service, whatever the case may be right now. The most common information and support needs are related to keeping their care recipients safe at home at 26%. Managing their own stress comes in at 26%, and navigating forms, paperwork, and eligibility for different services is 25%. The majority of caregivers, about 2 in 3 for each, feel that an income tax credit at 68% or a program to pay for or to pay caregivers to provide care would be helpful to defray the financial costs that are involved. And let's see, we're almost done. Despite how connected and smartphone centric that we are as a society, only 60% of caregivers report going online or doing something to help support care. So I would count you in that 60%. We're online and you're receiving some caregiver information right now. Let's see, just 44% of caregivers report their recipient has plans in place for future needs, and only 45% of caregivers have their own future care plans in place. So we need a lot more people to look at their future plans. So speaking of caregiver stress and caregiver support, I'll close this with talking about the Council on Aging in St. Tammany caregiver support groups. These are weekly groups, and during the COVID pandemic, we are still meeting. We have not missed a meeting. We meet at least 4 times a month, typically on a Tuesday. We meet for an hour and a half, or as long as that you want to join us. We are on the Zoom platform, so we have a video conference platform that many of you may be familiar with. And if you just want to join by phone, you're welcome to do that as well. Some people do that, so it's good to see everybody's faces. But if you just want to remain on the phone, we keep these as confidential as possible, in that everybody, by being on the call, promises to keep what is discussed within the call and not to share it outside with anyone that's not there. So I encourage you to consider joining our group. You can be a caregiver for anyone who is, actually I would say a caregiver of anybody. It doesn't matter their age, although most are taking care of someone who's over 60 and up. And they do, your loved one or your friend does not have to have Alzheimer's or any other type of dementia, although many of the people in the group are taking care of someone with these types of dementia. So consider that if you're interested at all in the support group, or if you have any comments about the caregiver coffees that we've been having. If they're helpful, let us know. If you see room for improvement, please let us know. And if you have any questions you'd like me to answer on these in the coming weeks, please send me an email at matt@carepartnermentoring.com. That's right there on the screen, and I will be happy to answer that confidentially. Just let me know. I'll just only use first names or initials, and we'll go ahead and answer that for you. So we are at about almost 18 minutes right now, so I'm going to close up. Thank you all for being here. Thank you all for liking and sharing this. It's a challenging job being a caregiver and a care partner for a loved one. So I appreciate what you're doing for your family, what you're doing for your friends, what you're doing for your community. Together, I think we can do this together. And while it's very difficult and has its ups and downs, try to see what you can, see how you are growing from this experience, what you're gaining from it, the strength that you're building, and the talents and the gifts that you're gaining as well as giving. So until next Monday, this is Matt Estrad signing off for the Coast Caregiver Coffee. Take care. Bye.